Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A physical therapist is treating a patient with upper extremity lymphedema following a mastectomy. When performing manual lymphatic drainage, which of the following best describes the correct sequence for initiating treatment? Option 1. Begin at the distal part of the limb before clearing the trunk. Option 2. Begin at the trunk before clearing the distal part of the limb. Option 3. Apply deep strokes along the entire length of the limb toward the lymph nodes. Option 4. Begin at the midpoint of the limb and work in both directions simultaneously. Manual lymphatic drainage is a specialized massage technique used to stimulate the movement of lymph fluid out of congested tissues. The technique follows a specific sequencing logic based on how the lymphatic system is structured and how fluid needs to be redirected. Understanding proper sequencing is critical to ensuring treatment is effective and does not inadvertently worsen congestion. Imagine the lymphatic system as a highway. If there is a traffic jam at the on-ramp, adding more cars from side streets will only make the congestion worse. The same principle applies to manual lymphatic drainage. If the proximal lymph nodes and trunk are still congested, pushing fluid from the distal limb toward them creates a backup with nowhere to go. The logical solution is to clear the highway first, open up the proximal drainage pathways before moving fluid from the periphery. That central to distal sequencing principle is the foundation of this question. Let's explore each of the options. Option 1. Begin at the distal part of the limb before clearing the trunk. Moving fluid from the distal limb proximally without first clearing the proximal lymph nodes and trunk creates a traffic jam effect. When performing manual lymphatic drainage in this fashion, there will be nowhere for the fluid to drain if the more proximal pathways are still congested. This is the most common error in manual lymphatic drainage sequencing, as the distal limb is often the most edematous, so it seems logical to start there. But starting distally without clearing the proximal pathways first would worsen the congestion rather than relieving it. Option 2. Begin at the trunk before clearing the distal part of the limb. Manual lymphatic drainage should always start centrally, clearing the trunk and stimulating the healthy proximal lymph nodes first. This opens up the drainage pathway so that when fluid is moved from the distal limb, it has a clear route to follow. The central to distal sequencing principle is the defining feature of proper manual lymphatic drainage technique. By beginning at the trunk and working outward, the therapist ensures that the proximal lymphatic pathways are open and ready to receive fluid before any distal fluid is mobilized. Option 3. Apply deep strokes along the entire length of the limb toward the lymph nodes. Manual lymphatic drainage uses very light, slow, rhythmic strokes rather than deep pressure techniques. The light strokes are designed to gently stretch the skin and activate the superficial lymphatic vessels just beneath it. Deep tissue massage techniques are contraindicated in lymphedema as they can damage fragile lymphatic capillaries and increase inflammation. Additionally, Driving fluid from distal to proximal without first clearing the proximal lymph nodes and trunk creates a backup of fluid with nowhere to drain. Option 4. Begin at the midpoint of the limb and work in both directions simultaneously. This approach has no physiological basis in lymphatic drainage. It does not account for the directional flow of the lymphatic system and would not effectively clear congestion in a systematic way. The lymphatic system has a defined directional flow. Fluid moves from the periphery toward the central lymph nodes and ultimately into the venous system. Working in both directions simultaneously from the midpoint ignores this unidirectional architecture entirely. There is no anatomical or physiological rationale for this approach, and it would not produce effective lymphatic clearance. This option can be eliminated quickly, as it describes a technique that simply does not exist in evidence-based lymphedema management. When we apply the central to distal sequencing principle across all 4 options, only option 2 correctly reflects how the lymphatic system works and how manual lymphatic drainage must be performed to be effective. The correct answer is option 2. Let's explore the all-student data. 60% of students selected option 2. Begin at the trunk before clearing the distal part of the limb, the correct response. 25% of students selected option 1. Begin at the distal part of the limb before clearing the trunk. 10% of students selected option 3. Apply deep strokes along the entire length of the limb toward the lymph nodes. 5% of students selected option 4. Begin at the midpoint of the limb and work in both directions simultaneously. This question is an other systems question which represents approximately 18% of all exam items. This question is an interventions question which represents approximately 26% of all exam items. This question is a Level 1 question since the question requires students to possess basic foundational academic knowledge. Remediation of Level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Looking to review related academic content? Check out page 566 in PT Exam, the Complete Study Guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.